Moving on to your biomedical therapies, as I mentioned previously, uh, mostly patients respond to some combination of psychotherapy and biomedical therapy. I'll reiterate that every patient is an individual, so which approach for therapy, which medication to use. Over what sort of a time period. Again, every patient is an individual, and most clinicians know that treatment approach needs to be tailored to the individual. So let's say someone who's suffering from depression chooses an approach for therapy, maybe CBT, and then goes on to an antidepressant to supplement their therapy. At a certain point, it would be up to the patient and clinician to decide how long therapy needed to continue and whether or not to continue an antidepressant indefinitely, which often is going to be an appropriate course of action for someone with, let's say, depression. So, again, our advancements for psychotherapeutic techniques and for biomedical techniques, they go hand in hand, and often course of treatment is going to be some combination of the two over various periods of time. For many patients, though, therapy alone or changing your behavior and your thought patterns alone, just through talk therapy, is not going to be sufficient. Many psychological disorders have biological roots, and the idea is that we can more effectively target and treat psychological illness by using targeted biomedical approaches. So, any biomedical therapy is going to be when we aim to physiologically change our brain state or our hormonal state to try and address the physiological correlates of mental illness. So this can be done using drugs. That's going to be the most common approach. There's other approaches that are not so commonly used, like the use of magnetic impulses to the brain or electric currents, electroconvulsant therapy. Again, those are typically not going to be the first line of attack. Typically, it's easier to prescribe a certain drug to help a patient. In some extreme cases, though, psychosurgery, again, this used to be far more commonly used. Psychosurgery at this point in time is more so a last resort, but in certain isolated cases, it might end up being a course of action that could be pursued. The vast majority of the time, we're going to be talking drug therapies or psychopharmacology. So, psychopharmacology is an area of study that seeks to understand the effects that psychoactive drugs have on our mind and on our behavior. There's many different psychotherapies available that rely on drug treatment, again, that go hand in hand with psychotherapy. But for many individuals who struggle with mental illness, being on an appropriate drug therapy is going to be the difference between being functional, being able to go out into the world, being able to be healthy, being able to function, and being completely non functional. It's worth having a conversation about the overprescription of biomedical therapies. I would say it is important to keep in mind that biomedical therapies are neither a cure all nor something to be entirely avoided. There is a sort of a balanced path in the middle whereby we can keep in mind that some drugs maybe have been overprescribed in the past. Maybe certain antidepressants or mood stabilizers that have severe side effects have been overprescribed in the past. But certainly on the other side, the idea that all medication should be avoided at any cost because it's poison, that's clearly not the case either. There needs to be a healthy understanding that drug therapies, psychoactive drugs, are powerful, and we should take into consideration that they can have undue side effects, but drug therapy should not be demonized as a crutch or something that people should be able to do without. There is definitely a middle path there. Drug therapies are tremendously important, but we need to understand just how powerful they can be. So, the major classes of drug therapies, the different kinds of prescription medications that are often prescribed and used in the face of mental illness, are going to fall under a series of classes. The ones that I'll mention are going to be your antipsychotics, anti-anxiety medications, antidepressant medications, mood stabilizers, and stimulants. So all of these are going to be drugs that have a wide range of effects, and as such, they're meant to target very specific mental disorders. So I'm going to start with the first three. I'm going to first touch on your antipsychotic medications. So this is going to be a very powerful class of drugs that are meant to help reduce psychotic and delusional experiences. So most commonly, this is going to be prescribed for individuals suffering from schizophrenia. Certain cases of individuals with bipolar disorder, additionally, may be prescribed certain kinds of antipsychotics. Certain antipsychotic medications can be helpful in reducing manic episodes associated with bipolar, but most classically, we see antipsychotics being targeted towards those with schizophrenia. The vast majority of antipsychotics are going to work by blocking dopamine receptors. Study on schizophrenia has demonstrated that there are irregularities with dopamine production and reception in those suffering from schizophrenia. And so, for example, a drug Haldol is an antipsychotic that works to treat schizophrenia by blocking dopamine receptors. Antipsychotics do have very powerful side effects, and a nuanced understanding of the treatment of schizophrenia needs to admit that these drugs do have powerful side effects that do make it very hard for an individual with schizophrenia to continue using these medications long term. There's a huge problem with individuals who are prescribed antipsychotics get better, and then the side effects are more salient, and as such they want to stop taking their medication, leading to recurrence of active bouts of schizophrenia. So it definitely is a complicated issue. Side effects like obesity, diabetes, movement problems, or catatonic sluggishness, these are all side effects that obviously can be very detrimental to one's well-being. So, despite the fact that these drugs are tremendously beneficial at reducing psychosis, their side effects are very potent and can make it very hard for these individuals to continue using these medications. Another term for your antipsychotic medications are what we call neuroleptics. So, again, this is going to be most typically prescribed when someone is dealing with schizophrenia or other psychotic based illnesses. Schizophrenia is the primary psychotic mental disorder, but as I mentioned, bipolar often can be actively treated with an antidepressant, typically in conjunction with a mood stabilizer. So these are frequently going to be your competitive dopamine antagonists, as demonstrated in the moving image there. The idea is that basically you keep dopamine from flooding your neurotransmitters, and it blocks them competitively from flooding your synapses. So the most common antipsychotic that you will often see prescribed for schizophrenia as a first line of attack, Zyprexa. Again, the downside of these medications is that they do have pretty significant side effects, and so it can be pretty tough for individuals to take these medications long term. The next class of medication that I'll touch on are going to be your anti-anxiety medications. So these are going to work to help calm an individual by reducing agitation and worry. They basically relax you. The most commonly prescribed acute anti-anxiety medication, your Xanax, which works as a depressant. So essentially, it slows down the nervous activity in your body and in your brain. So it has this very profound relaxation effect, which causes you to become sleepy, to become drowsy, and become very, very relaxed. And the slowing of your bodily and brain activity is often going to help calm those sort of nervous, rapid, or racing thoughts. The side effects of an anti-anxiety such as Xanax, one is that they are typically addictive. Xanax is addictive and it can be very dangerous, and you can overdose on Xanax, particularly if it's combined with alcohol, which has an additional depressant effect on the body. So if someone were to combine Xanax with alcohol to try and relax, that can prove a fatal combination because your body slows down to the point where your heart might just stop. Additionally, it can make you sort of slow and sluggish. Since you're becoming so relaxed, it can sort of impede your cognitive effort. But again, one of the most dangerous side effects is going to be the fact that you can become physically dependent, and as such, you can overdose or experience withdrawal. So, anti-anxiety, often anxiety is best managed with a combination of biomedical treatment and therapy. So, working with a CBT therapist to try and reverse your maladaptive thought patterns, try and reduce rumination and racing thoughts. But anxiety is also a physical disorder. There's a physical, agitated, arousal component of experiencing anxiety. And so the anti anxiety medication often helps calm the body's response, and the mind will often follow. Now, biomedical or anti anxiety biomedical treatment often works best hand in hand with the therapeutic component. If you're just physically relaxed, it doesn't necessarily turn off all of the negative thought patterns that might be occurring. So, anxiety really is a disorder that often responds best to a combined psychotherapeutic and biomedical approach. Again, the anti anxiety works by depressing your nervous system activity. And so there's going to be various ways that this could be achieved. One common path is going to be through your GABA agonist, again, working on your neurotransmitters to depress your CNS activity. Again, as I mentioned, given that your anti anxiety medications are depressants, it is very important to keep in mind the effect that it has on your body and just how it might interact with other substances. As I mentioned, you can become addicted to anti anxieties, and as such, you can experience withdrawal or overdose. And in particular, when combined with another depressant, of which alcohol is one, the body's nervous system activity can slow down too much, and that can prove fatal. So, anti anxiety medications are important. They're very, very helpful for people who genuinely have an anxiety disorder and their body needs to calm down along with their minds. Given that it is a medication that does make one feel very relaxed, often Xanax is used as a recreational drug, but it's important to keep in mind that, particularly if you're not someone who is particularly anxious, the anti anxiety medication is going to cause a slowing of your body's nervous system response to a level that might prove dangerous. Okay, so then moving on to your antidepressant medication. So, this is going to be a medication that's meant to help boost your mood and suppress depressive and anxious thoughts. Often, this is going to work by boosting levels of serotonin, by inhibiting serotonin reuptake. Famous antidepressants such as Prozac and Zoloft fall under this SSRI category, but antidepressants are not free from side effects. This is going to vary very much individual to individual. There's so many different antidepressants that work slightly differently, and thus side effects vary greatly for people who are depressed and taking an antidepressant. So it can range from dry mouth, constipation, reduced sexual responses, being extremely tired. The side effects run a pretty wide gamut. And so antidepressants are often going to be something that really do need to be worked out and tailored at an individual level between practitioner and patient, because there's so many different options for antidepressants that it sometimes takes trial and error to figure out which one has the effect that you want at properly controlling your mood while reducing the amount of side effects that one experiences. Some people, on the other hand, don't have any side effects to any antidepressant that they take. So it's important to keep in mind that antidepressants in particular need to be very, very individually tailored. As you can see from the list available here, there's lots of different classes of antidepressants. Your SSRIs, your selective serotonin reuptake inhibitors. These are going to be the most commonly prescribed antidepressants. They tend to be the most effective, but there are other classes as well because SSRIs don't work for everybody, and they do obviously have some side effects that people find quite unpleasant. So antidepressants, they are obviously going to often be prescribed to treat depression, but they also can be very, very effective for anxiety. Anxiety and depression are different, but they are often comorbid and they do share some features. So, despite the fact that you might think that depression, that sort of like being very down, would be something that causes someone to be sluggish and it might counteract anxiety, that's really not the case. It's unfortunately the case that depression and anxiety can quite well coexist in a single patient, that someone can have that depressed mood while having those sort of rapid racing negative thoughts. Often, if someone is presenting with both depression and anxiety concurrently, the first line of attack is going to be your antidepressant. Since these are not addictive, but they are highly effective for depression and anxiety, often this is going to be the first line of attack for helping someone with depression or anxiety. Additionally, other anxiety-based disorders such as OCD and PTSD, they often respond fairly well to antidepressants as well. Now, as mentioned, most often antidepressants are going to operate on the level of serotonin in your brain. So SSRIs, as the name indicate, work to boost the level of serotonin that one has by preventing the reuptake of serotonin. Interestingly, some research indicates that depression might actually be partially biologically derived from an overabundance of serotonin in the synapses, which then counterintuitively has the effect of causing too much reuptake, leaving someone with a net negative amount of serotonin. So, the exact interplay of how your neurotransmitters work in the brain and how the treatment functions at leveling out those neurotransmitters in the brain, we don't have a perfect understanding of how these actually work to have their therapeutic effect. Research just indicates that they do work, they do make people feel better, and as such, this is going to be the most common approach for treatment. One thing to note in the conversation on antidepressants is that they typically take quite a long while to take effect. So, whereas something like Xanax, an anti anxiety medication, works almost immediately at relaxing someone, antidepressants actually typically take several weeks to have a therapeutic effect on an individual. So, typically, when someone begins a course of antidepressants, they need to be on that medication for at least a month to see whether or not there's actually a therapeutic effect. Uh, this is interesting because these medications typically are having a more immediate effect on net levels of neurotransmitters. An SSRI does boost your level of serotonin quite quickly, but it does take many more weeks than that to see any therapeutic effect. So, again, this underscores the point that we don't perfectly understand why SSRIs work as well that they do, but the research pretty consistently shows that these are going to be likely the course of antidepressants that are going to work for the majority of people suffering from any of these depression or anxiety based disorders. Okay, again, I'll reiterate that many medications are going to work on the neurotransmitters in your brain, but in terms of how you can manipulate neurotransmitter levels in the brain, there's different approaches, and different medications will do this differently. Some are going to be competitive antagonists, while some are going to be synaptic reuptake inhibitors. So, this is partially why it's so important to sort of tailor a treatment plan for an individual, because different medications work in slightly different ways. And as such, they can have slightly different effects on different individuals. So, a different antidepressant, despite the fact that it's still in the same general class of medication, can have a very different effect on someone suffering from depression, because everyone is an individual. Every mental illness sufferer is different, and as such, these different approaches for medication can make a difference in just how effective it is at helping someone with treatment. Okay, a couple more classes of medication. We've got our mood stabilizers. So these are going to be medications that are meant to sort of level someone out who's having a lot of mood fluctuations. So antidepressants can accomplish this as well. Antidepressants can have a mood stabilizing effect. Mood stabilizers are going to be a bit stronger. So these are going to really be reserved for your more acute cases of bipolar 1 or bipolar 2, where people are experiencing more severe mood swings. Depression, on the other hand, is not so much associated with mood swings as a sort of a sustained low mood. So mood stabilizers are more so going to be prescribed for someone who's experiencing bipolar disorder, and as such have those more fluctuations. So, in terms of how mood stabilizers work, they are a lot more potent. So, medications that you don't necessarily see prescribed quite as much anymore, like lithium, these are going to be more so used for these more serious illnesses like bipolar or even borderline personality disorder. They do have pretty powerful side effects, and some of them can be addictive or dangerous. So, again, these are slightly more potent class of medications, and as such, any individual who's on a treatment plan that includes a mood stabilizer needs to be closely monitored by their clinician. And then lastly, we've got our stimulants. So, stimulants are interestingly used as treatment for ADD or ADHD. So, whereas you might counterintuitively think that someone with ADD, the last thing they need is a stimulant because we have this impression that someone with ADHD is bouncing off the wall, stimulants actually help work to counteract the symptoms of ADD and ADHD. The reason is because it actually seems like stimulants have the effect on someone suffering from ADD of helping them focus. It actually seems like individuals suffering from ADHD actually need a little bit of a boost so that they have more of a capacity to focus their attention, and this is actually going to be the opposite effect that a stimulant has on someone who doesn't have ADD. Whereas you would typically think that an individual who's taking Ritalin or Adderall is going to be jumping off the walls. It'll almost be like they're on cocaine or something. For an individual who's truly suffering from a bad case of ADD, you're actually going to see the opposite effect, whereby the stimulant is going to have the ostensible appearance of calming them down. That's because for someone with ADD, they need that stimulant to help control their impulses, use some executive functioning, and concentrate on the task at hand. Now, stimulants, again, this would be a drug that is often used for recreational purposes because it does have the effect of making you more awake, making you more alert, and decreasing your appetite. So, this is something that obviously I trust most of you know college students often will use to help them concentrate, or an individual might want to use a stimulant to help lose weight since it decreases your appetite. But again, these medications can be dangerous and they can be addictive, so it's important that the prescription of stimulants happens in conjunction with a clinician who knows when and how much of a stimulant medication should be used. So there's tons of psychoactive drugs that exist out there to various levels of effectiveness for different psychological disorders. Um, Often people are very receptive to new drug treatments that exist out there. The idea is, why would you need to do all the hard work of going to therapy if there's just a pill that you can take to cure a mental illness that you're struggling with? It's important to think cautiously about drug efficacy and to really think about which drug is appropriate and in what amounts. One point is that you can't necessarily assume that a drug alone is going to be able to cure most mental illnesses. For most individuals, a drug alone is not going to be enough. For something like depression or anxiety, really, a lot of the times, the drug alone can work, but until you give someone the cognitive tools that they need to reset their thinking patterns, the drug alone is not going to work. So, effective treatment for example, depression, often it's going to be getting the individual onto a course of therapy and starting medication simultaneously. As the individual improves, maybe you can taper off the drug levels, or maybe you can have less frequent therapy, or maybe you can go off therapy entirely once the person feels like they've developed certain skills. Overall, it's important to keep in mind that no biomedical approach for treating mental illness should be considered a cure all or a panacea. Some reasons for this are that some research studies that have demonstrated that drugs might have a therapeutic effect, well, you have to keep in mind that sometimes people just naturally get better. So, if people in a treatment group get better over the course of time, you need to be able to rule out that it wasn't necessarily a natural recovery effect. Additionally, people sometimes will get better just because they know they're on a course of treatment, the so called placebo effect. So, in evaluating whether or not a drug truly did have a therapeutic effect, you need to be able to rule out these alternative explanations. That's why it's really important before any drug is brought to market and sold as a helpful tool in help treating a mental illness, that it went through rigorous testing. So a really important testing procedure that psychoactive drugs should go through is what we call our double-blind study. This is essentially a study where the patients don't know which group they're in, whether they're in the active treatment group or the placebo group, and the administrator, the doctor, or the research assistant doesn't know either. The idea is that if a patient knows they're receiving active treatment, they might undergo the placebo effect. So you need to make sure that participants are divided into the treatment group and the control group, and that they don't know which is which. Additionally, you need to make sure that the person administering the treatment doesn't know which condition is which. The idea there is that if the research assistant or the practitioner knows which group is receiving treatment, it might bias their observations and have them treating those in the treatment condition differently or seeing changes that weren't truly there. So double blind means that neither patient nor administrator of the treatment knows which condition is which. This lets us be as unbiased as possible in evaluating whether or not a drug truly was effective. Now I'll just mention a few final versions of biomedical therapy that fall outside of these classes of drug therapies. Drug therapy is typically going to be the first biomedical approach that is used. It's the easiest. It tends to be the most easily accessible to participants, and it tends to largely be effective. Some of the time, though, if other treatments have not proved effective, there are some alternatives that exist out there that patients might benefit from. One that sounds kind of scary, because it is, but is still used in extreme circumstances today, is ECT, or electroconvulsive therapy. This is going to be essentially a treatment that is reserved for people who are experiencing severe bouts of depression that are resistant to therapy and other drug treatment. Now, the actual administration of ECT is going to be brief administrations of electric currents to the brain, actually resulting in a mild seizure. Patients might undergo several sessions a week for multiple weeks. Temporary side effects would include memory loss or slight blackouts from the ECT session. Often that memory will be regained after some time. Now, for those experiencing severe drug-resistant bouts of depression, ECT actually does have a really great improvement rate. People who are experiencing very, very severe depression that has not found any relief from other forms of treatment, these extreme cases do show some positive reaction to ECT. If you're familiar with Sylvia Plath, one of her most famous books, The Bell Jar, told the story of a young woman with severe depression who ended up taking ECT, and this mirrored an experience that Sylvia Plath herself had. Now, it does sound scary, it does sound draconian, it does sound like something from another era, and certainly it's not going to be the first treatment option for individuals with depression who do often respond positively to other forms of treatment. Now, ECT, though, is still an option, but it's really only going to be reserved for people for whom other more traditional methods have not worked. Now, despite the fact that it does help show improvements, it is not necessarily the best for long-term treatment. Often those who have shown a benefit to ECT treatment will experience a relapse. Now, I'd like to show you a short video showing the administration of ECT to a woman who had experienced a severe bout of depression to give you a sense of what this might look like. Again, this might seem like a sort of a hardcore last resort sort of an option, and it is. I will say, though, that despite the fact that this is seen as a last resort, the use of ECT today is done in as humane a way as possible to minimize the pain and discomfort that these patients go through. But again, I will reiterate that it is a last resort, but it is effective for these very, very stubborn cases of depression. So let's watch a short video on the usage of ECT.
Electroconvulsive therapy, or ECT, is a powerful way to treat severe depression, but it is used only when traditional medication approaches have failed.
Just second.
What about you was different?
Everything. I smell.
You have a body odor?
Mm-hmm. My hair's falling out.
Hmm?
I'm disgusting. I'm evil.
In fact, you think that you should be dead. Did you try to kill yourself? Did you really?
Yeah.
Tell me about it.
Took a bunch of pills, aspirin,
When was this?
on Thanksgiving.
When Mary attempted suicide, it opened all her feelings to the world. They now were expressed in all their intensity. She was worthless, hopeless, life was not worth living. She felt she was the devil, and she had the idea that the only way to end this terrible pain was suicide. She tried at home. Her husband brought her right to the hospital, and from that moment on, she had to be monitored. We had to have an individual sit with her 24 hours a day, because all she could think of was trying to kill herself. There were hours in the next few days that we had to put Mary into restraints. The alternative was that she would scream and try to kill herself by any device possible. It became necessary to treat her as rapidly and as effectively as we knew how for this drive to suicide and this very severe feeling of unhappiness. At the beginning of ECT treatment, the patient is put to sleep, and 30 seconds later is given a dose of muscle relaxant. The Brevitol's going in. Nice deep breath. You'll be fine, though. The lid reflex is gone. Cup is up. Okay. Bite block is in. Chin up. Impedance is low. Okay. At that point, electric current is passed through the brain for a duration of half a second to 4 seconds. Typically, 6 to 10 treatments, spaced over 2 to 3 weeks, will be given. ECT produces a seizure, which needs to last for 25 to 120 seconds to be a good or effective treatment. After ECT treatments, patients will show confusion and loss of memory for recent experiences. Both of these problems clear up, and permanent memory problems after ECT are rare.
Mary, open your eyes. Treatment's all over.
In Mary's case, medication did not help, and so electroconvulsive therapy was the best alternative. After treatment, Mary discussed her recent depression with her doctor.
The depression that I came in here with, I don't really remember much about.
Remember nothing about it?
Mm-mm. I do remember going home being in the hospital here and going home on Thanksgiving and taking a lot of aspirin. I remember that.
What happened on Thanksgiving?
I remember thinking I was the devil.
Yeah.
And taking aspirin, and then my son coming from my neighbor's house and coming into the bedroom, and then I remember feeling bad that I had done that, because I didn't want to die and leave him. And when I told him to go tell his father that I had taken a bottle of aspirin.
Electroconvulsive therapy has a very important place in the treatment of certain depressions. It's not a panacea. It doesn't help everybody. But it remains a very effective way for quickly reversing severe depression.
Okay, so again, this is a treatment approach that's used for very, very specific cases whereby other easier treatment options have not been used. Again, it sounds scary, but as the video showed, they're not being electrocuted. They are inducing mild seizures. The depression is often very immediately substantially improved. So this is something, it's mostly a tool in the toolbox of clinicians treating severe depression, but it's not going to be the first line of defense for sure. Another interesting approach is what we call deep brain stimulation. Again, this is a approach that's going to operate on the physiological brain makeup of an individual suffering from a mental illness. This is obviously a more invasive and more extreme approach whereby an electrode is implanted deep into someone's brain to administer electrical stimulation over a period of time. Where the electrode is placed is going to be dependent on what disorder someone is experiencing. So, for example, in individuals with depression, we do know that there's associations with differential activity in the limbic system, the so-called emotional part of the brain, or the frontal lobe that has to do with long-term thinking and planning. So these areas, which might be overactive in individuals with depression, might be targeted by deep brain stimulation. And as such, we use the different electrical communication systems in the brain that we know are associated with mental illness to try and change what is going on in someone's body. So again, the physiological correlates of mental illness are really going to depend illness to illness, individual with individual, but we do know that there are these physiological correlates of mental illness, and by knowing that, we can target our physiological treatments to try and change what's going on in the brain and in the body in specific ways to help people improve. And lastly, the psychosurgery approach. Again, this used to be something that was far, far more common in the treatment of mental illness, including lobotomies that often targeted areas of the frontal lobe in people with mental illness. We really don't do that very often anymore today, except in maybe some extreme circumstances. Psychosurgery is really not going to be a treatment option that works for most people. Again, the vast majority of individuals with mental illness benefit from some combination of therapy and medication approach. Any psychosurgeries that do happen today are much more carefully carried out than they used to be. They're what we term microsurgeries, in which very, very small areas of the brain are targeted. We know a lot more about the brain makeup than we did 100 or 50 years ago, and as such, we can do more targeted surgeries. And these are obviously more extreme, obviously more invasive, but for example, in participants who have a lot of seizure activity, we do know that, for example, cutting the corpus callosum, the area of the brain that connects the two hemispheres, can help reduce seizure activity. But obviously there are going to be a tremendous amount of side effects that someone with a split brain or a cut corpus callosum experiences. For example, it impedes people's ability to perceive and see things in the different areas of the visual field. So this is obviously going to be a last resort. Again, something like an extreme seizure disorder, this psychosurgery approach might help, but something like a seizure disorder can often be targeted with other sorts of medication. So psychosurgery still does happen today, but it's a lot more careful, and it's done in a way that's a lot more humane and benefits from all of our new, more advanced understanding of mental illness and how it functions. And then lastly, a approach for therapy that might help target the way that mental illness plays out in our body in a physiological way, but that is going to be more alternative and definitely less invasive. One might opt for what we call a therapeutic lifestyle change. So, for example, there are courses of therapies where individuals enroll for, let's say, a 12-week course, and a series of activities are taken throughout the 12 weeks to help get someone's body in a place where their mental illness might be improved. So, for example, we do know that exercise can have a positive effect on mental illness. This is often something that is suggested in therapy for depression and anxiety. Getting yourself to do some exercise has the effect of changing what's going on in your body. It changes your level of hormones and it can help treat mental illness. Again, just telling someone who's depressed to work out to get over it is typically not going to cut it, but this is something that can help some individuals. Making sure that you get an adequate amount of sleep. Again, sleep is going to be something that's impacted by mental illness, so helping make sure that people get an appropriate amount of sleep. Some light exposure therapy. Some mental illnesses can see a benefit from some light exposure. For example, seasonal affective disorder, in which people become depressed in the colder, darker winter months, can benefit from some light exposure. Boosting the amount of social connection that people have, so making sure that people in the course are connecting with other people and having conversations and creating those affiliations. Again, we know a ton about just how important social connection is for your physical health and then in turn your psychological health. This might be part of the course. Having some anti-rumination therapy to help redirect people's negative thoughts, maybe doing some nutritional supplements. There's some indication that nutritional supplements and vitamins like omega-3 might have a beneficial effect on someone's level of depression. Overall, this is a sort of a lifestyle change system that is meant to give people some tools, some ways that they can change their lifestyle to help improve their mental illness. Now, I will say that for sure, this is not going to be something that everyone can or should do. This is not feasible for many people, and it's not going to cut it for treatment for most people. But this is a sort of an alternative program that exists out there that tries to help combine different elements of psychotherapeutic approaches and biomedical approaches to help people struggling with mental illness. Overall, I would say the broader thesis of these two treatment lectures is that there are tons of ways that we know we can help individuals struggling with mental illness. And for anyone who is struggling, there's likely a course of treatment that would work for you. With some combination of therapy, lifestyle changes, medications, mental illness can be managed, and people who do suffer from mental illness can live full, thriving, healthy, happy lives. And so the main idea of psychological treatment is just helping people function as best as possible in a way that helps them manage the difficulties that they experience with their mental illness. So the field of psychology has given us a wide range of ways that we can help people function even in the face of some of the most difficult psychological disorders. So that's going to do it for this round of lectures on psychological treatment. Thank you for listening.